Hi, folks. Welcome to Profiling Evil by Mike King. I'm here with my good friend Chris McDonough, and today we've invited a special guest to be with us, Dr. Amy R Salerno. Doc, how you doing today?
I'm doing great, and thanks for having me.
Oh, we're thrilled. Isn't this a great day, Chris?
I'll tell you, it couldn't get any better than this. We're grateful that you're here, Doc. We're excited, very excited. Code 33, everybody. This is going to be a good one.
We're going to cover some really interesting things today, but first I want to tell you a little bit about Dr. Salerno, and I want to read a little bit so I don't miss something important here. But Dr. Salerno is the physician site lead for Zufall Health Center in Hackettstown, New Jersey. She oversees the care of medically vulnerable communities, folks like migrant workers, unaccompanied minors from Guatemala and Honduras, and refugees who are fleeing war-torn countries from the Middle East and throughout Africa. Amy graduated magna cum laude from Duke University, and I'll tell you, it's just really neat to have her here. Not only did she complete her medical training and her residency, but she did so at the University of South Carolina of Medicine. The thing that I think, Amy, when I think back about you that I'm most impressed with is the fact that you spent time in Latin America and in the Caribbean as a medical missionary trying to give back a little bit. And I know the folks online are going to appreciate that, but this is something that's really important to Chris and me as well, that the kind of person that you are, that you'll give of your own time and resource to go out and serve others. Thanks so much for being here.
Well, thank you for having me.
It's really, you know, we have the privilege of knowing your two beautiful daughters. How did they help you jump into this amazing medical career of yours?
Well, it's a very interesting story because I personally am from an Italian as well as a South American heritage, and Italian and Spanish language and culture have always been very important to me. And in having worked for about 6 years in Rhode Island with the Guatemalan community and the Colombian community, I had a sort of an epiphany that I was getting a bit older into my 30s, and I have this strong maternal instinct and felt very strongly that I wanted to be a mom. And so I made a decision after having worked in Latin America and the Caribbean amongst many different indigent and peasant communities, that I had a calling really to adopt a couple of babies, one at a time, that were orphaned at birth. And so I made 4 trips down to Guatemala. I have many friends and connections down there. And so I first brought Francesca home at 5 months of age, and then Dorsey-Camila subsequent to that a few years later. And because I had already immersed myself in my mission to serve people of my similar cultural background, and now I'd made a commitment to my children to bring them from a place of great poverty and the end of a 35 year civil war in Guatemala with a torn economy. I wanted to continue my commitment to the community, especially the Guatemalan community. And in so doing, I was able to bring my children up bilingually, and we began to cultivate great friendships amongst the patient community that I served, and they were fired up about wanting to know a lot about their Maya culture, even though they are not purely indigenous. They are mestiza, and it really kind of propelled me through the years to continue this commitment to work with the medically vulnerable.
Awesome.
That is really not only touching me because we have gotten to know them a little bit, but to know the commitment that you've made. I'm going to just stick something up here, Amy. I hope I don't catch you off guard, but this is really, I think, just a nice view of who you are as a person. And I want you to just tell people how long you've been doing this medicine thing.
My daughter found that picture of me. I have wild child hair, which I tried to, now that products have been introduced in the past decade, I have been able to tame. But picture number one was in 1990. It was my premiere week when I donned my first long coat below the hips. We were able to, once you become an actual MD and not a medical student, they had a sort of a coat donning thing. I don't know what you want to call ceremony, I suppose. And so there I am holding lots of contraptions, I see, because I didn't know a whole lot then. So I had lots of books and pieces of paper, as you can see. So that is in 1990. That is my rookie year as a physician in South Carolina.
Awesome.
Those are great pictures, and I love the more recent one.
So I was tired there.
Yeah, I imagine after 30 years of medicine, you are tired at times, Doc. Thank you. Now there was one other thing I've got before we get down to business. I got to throw one more curveball at you with a little more speed to it. I understand that from this is now Chris and I are in the intel business as investigators, that you were a fan of the old emergency television program, and you kind of had a crush on Randolph Mantooth. Why don't you just tell us a little of that as we kind of bounce forward and give people a sense of...
Well, there is, let's put it this way. I grew up, my dad was a physician, a surgeon. And yes, we were only allowed to watch a half an hour of television a week. And then back in the day, there were maybe 2 or 3 channels. So each child of 4 got to pick one show. And my show was Emergency.
Awesome.
With Randolph Mantooth. And that's what I called it. So every time Emergency came on Friday night, my siblings would say, Amy, Randolph Mantooth is on. I would come running down, and to me, he just set the bar as an honorable man of integrity. Of course, he was cute, and he still is to this day if you look him up, but I was just drawn not only by Randolph Mantooth's persona as an EMT paramedic, and his cuteness aside, but also because he was at the cutting edge back in the day before there were ever EMTs and paramedics actually in the field. It used to be when my dad was growing up, they would go out to the field. My dad was an ambulance driver, and they would get a gurney, they'd pick them up, they'd throw them in the back, and my dad would drive them to the hospital and dump them off and, hope that all went well. But Randolph Mantooth and the emergency show, which I think lasted about 7 years, really showcased the creation of a national sort of movement towards the EMT and paramedic profession. And I believe Randolph Mantooth is now 75 years old. I mean, I have been following him on the internet. And yes, he is married. So, but anyway, he continues to dedicate himself to the movement of excellence in pre-hospital field evaluation and treatment of patients. And I was just completely blown away by this whole thing that he propelled. And he has won many, many awards internationally. Even at the tender age of 75, he continues to be known for support of paramedics and EMTs. And it is my belief as a physician and somebody who's worked in the emergency room as an attending, we could never do it without people like Randolph Mantooth, who represents paramedics and EMTs. So
Have you ever met him personally?
no, unfortunately I haven't, but I will say, I'm not going to give it all up, but I will say that sometimes they'll ask, like, your security question, like, what's your favorite food? And I'll put popcorn. And then they'll say, what's your favorite movie star? And I'll be like, Randolph Mantooth. And everybody around me is like, what? And I even told my children that, and they were like, Mommy, you're weird. And that was a couple of years ago. And I said, I want you to see Randolph Mantooth and Emergency. So we bought a whole series, and they got hooked. And they were like, this is deep, Mom. And not only is it deep, he is pretty good looking. Yeah, he was looking back in the day.
That is awesome.
That's awesome.
So here's an assignment for all of our listeners. If any of you have an angle to Randolph Mantooth, please let us know, and we're going to make a connection here just so that you can meet your lifelong crush. It's really amazing, Chris. If there was anything that reduced the number of homicides in the United States, it would be the paramedic program, wouldn't it?
Oh man, I'll tell you. And Doc Salerno talks about it where, back in the day, they would, it would be scoop and run. Mm-hmm. Just throw them in the back of the ambulance and take off with remember the bubble gum machine on the top of each of the ambulances and stuff. And it's an interesting dynamic because while she was watching Emergency, I think you and I, Mike, were probably watching Adam 12.
Yep, that's right.
I love
right across. So, yeah. And speaking of emergencies, we could have not have a greater guest on with us today because I think, Mike and I have been talking, guys, about, a lot of the bodies that have been dropping around Chad and Lori Daybell. And so we've thought of, put our heads together, and we've got Dr. Salerno here today. And so, Mike, what do we got on tap?
Yeah. Thanks for teeing that up, Chris, because Dr. Salerno, what we really wanted to do was just kind of walk through each of these homicides or unattended deaths that have occurred along the way in this wake that's been left by Daybell and Valo, Lori Valo at the time. Let's go back a ways to one that's just not talked about very often. And let's just chat a little bit about Joseph Ryan. This is Tylee's father, as you all remember. This was husband number 3 for Lori. The first 2 ended in divorce. This one now ends in divorce. But I don't know, it's like about 14 months later or so, he ends up deceased. And the thing that troubled me, I think, as I read this, there was a report by People magazine that talked about it was actually a neighbor who became so disturbed that she hadn't seen Ryan that she went over, and that's what led to him being reported. He'd been dead for some time, hadn't he, Doc?
Yes, he had been. Before I make any comment regarding the really 4 cases of adults that surround the Ryan Vallow Daybell case, I did want to mention that the opinions that I'm giving you now, first of all, are not related to the work that I do with my current employer. They really are founded and rooted in my 30 years as a physician, especially in my work in the emergency room, as well as in my work in psychiatry and family medicine. So I just wanted to let you all know and our audience that I am not representing in any way my employer. I am disturbed by Joseph Ryan, his demise, and for a couple of reasons, one of which is that, and this is not something that a medical examiner would or a pathologist would know. Generally, when we see a patient who comes deceased and an autopsy is decided to be performed, necessarily the medical examiner doesn't have any psychosocial background per se on the patient, unless it's considered a suspicious death. However, in the case of Joseph Ryan, I believe his divorce from Tylee's mother, whose name is Lori Vallow, occurred approximately in the year 2006, 2007, but there was an extended court deliberation over custody through those years, really until probably about the 2010 or so year. Accusations flying from Lori that there had been some sexual predation, especially on Colby, who was adopted actually by Joseph Ryan. He's not his biological son. Never any accusation by Ty Lee, who was very young at that age, but it became so rife with struggle, especially on the part of Lori, that at one point, Alex, who is the now deceased brother of Lori, Vallow, actually went after Joseph Ryan, and he tased him with a stun gun, running after him outside of a court meeting. And as I understand from the reading I've done, he tased him and he fell and he fractured something. Alex had to do 90 days in jail, and he appears to have had an obsession with Joseph Ryan and tried to garner folks within the prison to perhaps go after Joseph Ryan. So only knowing the backdrop and this story would one then fast forward to 2018 and discover that Joseph was found deceased by his neighbor. Appeared that he had been deceased for 1 week, and the circumstances were unclear. Because he was, yes, sorry.
I was just going to say, in April was this in Gilbert as well? Do you remember, Chris? Or
maybe it have been, I believe it was in Texas.
Oh, in Texas.
I may be misspeaking.
But I mean, even in really cool conditions, a week on a body sitting in a room, the decomposition can be pretty remarkable. Then as you start to add some heat to that, so they find this body, the neighbor reports it, and the body is then taken to the ME's office. And what's the next step on those kind of things?
Well, I mean, the next step in this case was that he did have an autopsy done, but in reviewing what is available to the public, the documents of that particular autopsy of Joseph Ryan, it is what I would deem a cursory autopsy. And what that means is that because he was moderately decomposed, bloated from decomposition, the medical examiner did
what. So this is in Arizona. Let's catch this real fast. It's in Arizona, Maricopa County. It's not Texas.
Okay.
Yeah.
It's Joseph Ryan.
Yes.
So let's zoom in on that one, just up onto the. There we go. Yeah, so Maricopa County, Phoenix. Okay, so even April by this time, I mean, we're talking 70s.
Yeah, it's cooking.
Right.
Yeah,
it's cooking. But I'm sorry, I didn't mean to interrupt, Doc.
No,
I
I'm
just
glad that you clarified. It is really hard with all the different states that have been involved to
not a problem.
This. But of note is, first of all, and Joseph Ryan's sister, Annie Cushing, was sort of aghast and has made comments that they did not get the height nor the weight of her brother correct. They said he was heavy set, the weight and the height didn't match. And so it really does look somewhat cursory. The examination was done just on the external aspect of the part of the patient. They did not actually, from what is presented here, actually cut the patient open for a full autopsy to see were there underlying causes, even heart disease or any toxicologic, although at some point they did take a chunk of his thigh for use later if they would want to do further toxicologic studies. But what I find very curious is that the final diagnosis of natural causes was purely based on the fact that Joseph Ryan had a cursory external exam, and he carried the diagnoses of hypertension and hyperlipidemia. And ergo, cardiac arrest, natural causes, and then cremated.
This was always troubling, I think, to those of us that were patrol officers too, that you could roll up on a scene, and because someone had seen a doctor in the previous 30 days, it could be classified as an attended death. Yeah. When there were so many questions that were still up. And I while we were talking, I just did a little quick research. Temperatures in Phoenix in April are 86 in the highs and 59 at night. So yeah, let's go back to this idea that body had been baking for a while.
Yep.
So nobody actually came to claim him, despite the fact that I believe it had been 15 years since Laurie Vallow and Joseph Ryan, husband number 3, Tylee's father, had formally and legally been divorced. She was and had been in major custody battles through the courts. The only next of kin contact on Joseph Ryan was Laurie Vallow. So she was called. She did not claim his body. Apparently made some comments that he was just better off dead. She did not notify his sister Annie Cushing, and apparently he lay in the morgue for weeks until the Emmy was able to contact Annie Cushing's brother. So you have somebody who's very distantly connected now, Laurie Vallow, but somehow remained named as the person of contact, and interestingly is in receipt of his life insurance. And it's unclear to me whether in the research I've done, whether the life insurance was split between Tylee and Laurie. And I think Laurie was supposed to be in charge of Tylee's piece until she became emancipated, so to speak, at age 18. So that,
and she dies before that period, which would then roll to her as even a question of whether that would be something that would then fall back on her if the child dies. That's
right. Yep. So that's curious.
Mm-hmm. So interesting enough, right? So I mean, we have all this backstory of all the bitterness and the fighting, all of the the allegations at this point. I mean, we want to be sensitive to that stuff because we don't know factually what it is yet, right, in totality. But it kind of does lay an interesting fact pattern out potentially that leads us into a guy who's living a pretty, sounds like a distant life here. Mm-hmm. And all of a sudden, he just drops to the floor at some point, and you've got a week that goes by, and a neighbor is calling the cops, and Mike, and you get that welfare check, and it's literally almost simultaneous. That's exactly what Charles Vallow was doing the night he called 911 to say, hey, I need to go check on my kids. I need a welfare check out here and he lays out a scenario where, Laurie's going Looney Tunes. And so they get there and they've got this unattended guy, deceased here, Ryan. They scoop him up, put him in the ME's office, and the ME comes out with a report as, what were your overall thoughts, Doc, on what you saw overall about this report?
For Joseph Ryan.
Yeah,
yes.
Joseph.
I think that with all due respect to the ME, had he or she had no backdrop, common things are common. And one has to make, like we learned in medical school, you hear hoof, sounds, you don't think zebra, you think horse. So in this case, the ME did, I'm sure, best due diligence and had to make a narrative that was consistent with what was found and was based on outside medical records of hypertension and hyperlipidemia. And no fingers can be pointed there because that backdrop was not known.
Yeah, no, it's very common. Go ahead, Mike.
Yeah, and this isn't about Monday morning quarterbacking, because we can all in hindsight say, oh, I wish I'd looked a little further. But yeah, I mean, he followed, or she followed all of the check boxes to make that decision.
Yep.
But if I understand you right, if they collected a piece of tissue, potentially you could go back and at least learn a little more.
I think you can. Now, we're going to talk at some other point later about toxicology testing and how many toxins and poisons have a very short half-life. And especially if somebody's been deceased, then you're not going to be able to, extrapolate and measure certain tox levels. So,
and for our viewers, Doc, half-life is how long the drug will stay in your system.
Well, basically,
right?
It's taking your full dose. Let's say you take 100 grams. It's the time it takes to clear half of that out of your system. And with some, which we will talk maybe a little bit later, the half-life can be 5 to 10 minutes. So by the time the person gets to the hospital, gone.
Is it possible that poisons can be absorbed into the muscle tissue?
It is possible, yes, but I'm not a chemist and I'm not a toxicologist, but from what I have read, there are a certain number of commonly checked toxins, and then you go down the bunny rabbit hole of could it be this, could it be that? You cannot check everything, right?
Yeah, so you got to know what you're looking for.
Right. Yes.
Good point.
Well, so Doc, before we move on from Ryan, because we got 3 other bodies to talk about here, how many cases do you have that kind of number rolling up? Anything else that really stood out to you as remarkable that you think we just ought to have somebody looking further into? And then let's jump to the next one.
Well, I think for me, the only 2 things that I find compelling is I did review the entire several long year court case of custody battle between Joseph Ryan and Lori Vallow, who Lori Vallow had put many accusations of Joseph Ryan being a sexual predator and a pedophile. And Joseph Ryan submitted himself to many psychosexual evaluations and tests. And the documents bear out that their findings are that Joseph Ryan fell within the normal range for a male, and that he was at 0 to minimal risk of sexual predation. And so there is a piece of me that believes, post-mortem, there is a piece of me that hopes that he can be vindicated, because I think he did, albeit he had his broken aspects to his personality, but I believe that the metrics that evaluated him pointed that there was little to no likelihood that he was a sexual predator. And so he spent the balance of Tylee's life in vain trying to, not only did he win custody and shared custody, but he was unable to even experience that because Lori absconded with her and went into hiding over many years into many different residences. And that is, to me, not part of his autopsy, his physical autopsy, but I think it's part of his psychological autopsy that needs to
Interesting.
Yeah. How sad.
So who do we have next?
Okay.
So yeah, the next thing that falls in line, Chris, is Charles Vallow. And of course, we went into this pretty deep detail the other night, and we would push you all back to those videos where we talked about the homicide of Vallow, and I call it a homicide. There were a couple of things that really made us wonder specifically about the way the body was lying at the time that the officers walked into the residence. So Dr. Salerno, I guess that would be the one place we just want to start with you, is to just say, I mean, sadly, you've seen a lot of dead bodies too. Tell us what your thoughts were when you saw that imagery.
I was honestly, well, I would say between troubled and stunned, because in my experience, dealing with not only people who have been traumatized by either accidents, gunshot, fires, whatever, they're so rarely found in a position that I had previously mentioned, what we call in medical school the anatomic position, which is if you're standing up, it's your arms are out, your back, you're flat. It's an anatomic position, which is ideal when you're learning about dissecting and human anatomy and physiology, but it's not a very natural position for somebody who slumps over. And it was a very unnatural position to me. And to find him literally at almost like his arms almost at, let's say, a 30 to 45 degree angle symmetrically. Everything was symmetric. And I've never seen that before.
That's the kind of term Chris and I kept using, was how symmetrical everything looked. Chris, yeah. You've been on a lot of high trauma murder scenes. How often do you see that body perfectly laid out like that?
Well, Mike, I mean, you and I, right, when we first saw it, we said, wow, this just doesn't look right. And, what's going to be key here is, and we don't have the autopsy report, but it's going to be interesting to see where some of the lividity patterns are on this body. If, in fact, the timeline, if he was shot earlier or whenever, that timeline's going to sort itself out. And we have great confidence still in Gilbert PD that they're flushing through this. And I think this lividity pattern, if it is not consistent with the positioning of that body, and he has been sitting there or laying there for 15, 20 minutes. I mean, and Doc, correct me if I'm wrong, but the moment that heart stops, that blood starts dropping.
That's right.
It's just going to sit, and we're going to get that pattern. And, that could be one of the reasons why we're not seeing the autopsy report is because they want to hold that card for the interview room.
Right. I think the other piece for me was, as somebody who has done CPR in the field, in the emergency room, many, many, many different places, unfortunately, there's really no way that I would be able to maneuver my two knees into a position where I would be correctly able to give CPR with two arms the way they were. And my question would also be, because I did notice that the EMT or paramedic that was there was doing very shallow, mostly because it was clear that he was deceased. So you wouldn't expect at that point, he was pulseless, etc. But to do CPR correctly, whether you're an amateur or whether you're a professional, requires tremendous effort, caloric expenditure, copious sweating, and you literally have to physically hear and break the sternum and the ribs in order to get to the heart so that you can adequately, give pressure to it for circulation. And so I'd be curious to know, were there any ribs broken? I mean, what was done there?
Absolutely. That's interesting, because that was one of my first thoughts. I remember the very first time doing CPR, actually pulling my hands back. I was frightened by that fracturing that was occurring.
Yeah.
Yeah. And
So
what
what
about
do
the fact that Alex doesn't have any blood on him, Doc?
No, he has nothing on him.
Gunshot wound to the front,
Yeah,
to the chest area. Right.
Which usually the entrance wound, and he didn't appear, even if he quickly washed up, he did not appear that he was perspiring, that he was exhausted, and I didn't see any markings on his clothing that would be consistent, even on his knees, be consistent with having done CPR. And then if you listen to the 911 call, you really can't do CPR and have your phone like this talking.
Yeah, and talking the whole time. Yeah. Really something. Doc, anything else on this one before we move on? And Chris, I want to know the same thing from you.
I'm just trying to think.
I want to wait for the autopsy report.
Yeah, I agree. I don't think we have enough information.
Yeah. Just more questions, which is really what investigations are about, isn't it?
It really is.
I'm sorry. Go ahead, Doc.
Yes, I'm sorry. No, I think the other sort of big thing in the room, so to speak, the elephant or whatever they call it in the room, is that bat, which, from what I could glean, looked shiny, brandy new. And given the fact that Charles Vallow was a robust, strapping gentleman with history of minor league baseball, I think that this small, tiny little contusion maybe on the back of Alex was not consistent with his report of having been assaulted by a bat.
Yeah. Interesting.
I think the other elephant, Doc, we're going to, from an investigative point, also, we're going to raise you just a step here for a second, and that's going to be a herd of elephants, and that's going to be 4 of them.
Oh.
Okay. The shell casings. Those are going to be the other elephants in their location. And if you get a chance, go see the shell casing video we put up, because Mike and I, and Mike, what's your thought on that one?
That'd be good, Doc. In fact, maybe you could go watch the show sometime and give us some insight.
Yeah,
I did watch that twice, and I have a spatial problem. Not special, but spatial. And I would need somebody to walk that through with me, because I couldn't figure out, I had some difficulty figuring out where, because of the video cam, where I know 2 were against the wall and there were 2 on the other side.
Yeah.
Which makes me believe probably he was shot bidirectionally.
Yeah, and that's what Mike pointed out, is he's got to be coming towards him from the hallway out into that room, boom, boom. And Mike, we got the 2 to the right. Mm-hmm. But then, as Mike mentioned, we've got a positional change here where those other 2 somehow end up against him on the right side of his body. So, so everybody run back and go grab that one and tell us what you think.
Well, I also thought it was very interesting that Lori Vallow, if you listen to the police officer outside speaking to her story was inconsistent with what her brother said, but she, from the best I recall, stated that she had heard the shots and that she stepped over her brother and walked out, and then decided to take the car, take his phone, and take the kids in the room.
Not call police, but drive to school. Yeah. There's some wacky things there, aren't there?
That makes me wonder, and I don't know enough. I'm not a ballistics person at all, but was there a second gun? I don't know. Did she, from a different direction, hit him? I don't know.
Yeah. And yeah, we'll dive into that one on the next one. Let's jump towards who's next, by the way. Who falls next?
Yeah, let's talk about Tammy Daybell for a moment. She reports someone with a paintball gun shooting at her. I don't really know that story well, but 10 days later, she mysteriously dies. Somehow the autopsy is not performed, and they allow the body to be buried as an attended death is the only thing I can put in my mind. And then later, as the lights start flipping on, they exhume the body. We don't have anything there, Doc, but there were some findings in some of the reports that we posed to you. Maybe you could talk a little bit about those.
Well, I think first of all, I think this is hearsay because there were two statements made by the husband, Chad Daybell. One initially was that she had a cough the night before and during the night, and that when upon awakening in the morning, he said he found her cold and dead with some pink froth, but had not heard her gasping. She was not in any sort of respiratory extremis apparently during the night. He slept through all that. So you have that, but then in the recorded telephone call of Melanie Gibb that was played in court, he offered up to Melanie, oh, Melanie, this is a paraphrase. Oh, Melanie, don't you know that my wife was sick? I knew for 3 years that she was going to die an early death, and she was sick and weak and got weaker and weaker over time, and she didn't like to go to the doctor. And I know that my son Garth was there to witness the death. At the time, he was there with me upon the moment of her death, and within 20 minutes, my other children arrived. So there is a discrepancy in that story. You see?
Yeah.
So dead and cold upon
dead and cold when I wake up. Yeah.
Or did they attend her final gasp and then call 911? And there were apparently two, maybe MEs, I don't know who came and to pronounce her. We don't really have that information about what were their findings, do we?
No, not yet. But here's an interesting point from an investigative position. So notice in the first one, right? Let's go back to, Charles, for an example. Okay, you've got in that particular problem, you've got husband number 4. Killed by Alex, etc. Okay, but you have on the peripheral edges witnesses to the concept, okay, to the idea, the presentation of this is what happened, okay, and now you contrast that with the phone call that you just pointed out. Who did he introduce into the conversation? Okay, you'll see a pattern here where sometimes suspects or subjects who are under extreme pressure to, they slip. And what they do is they introduce this, and this goes back to what Mike and I have been talking, the we, us, and them. Okay. So in the first one, we have Tylee's introduced with the bat. Okay. In this one, Chad introduces his son,
Garth.
Okay, to Garth. To look at the examination, or don't ask me, ask Garth.
Right.
Okay. And now we can take that into other cases where you can have these individuals who are making the we, us, them concepts. Okay. And these are two perfect examples of how that can play itself out in an investigation. So I wanted to point that out as you mentioned that. Pay attention to those minutiae details, because they could have some serious implications in the long run. And I'm sorry, Mike, I didn't mean to kind of get off there for a second, but kind of caught it here for a moment.
No, what do you think, Doctor?
Well, I think there's number one, there's an inconsistency in his story, right? Number two, nobody just dies in a vacuum. It's, there's always some sort of a narrative behind a death, generally. Unless it's a SIDS death, like a sudden infant death, of a 6-month-old or something. Usually that comes out of the blue. But in Tammy's case, there's evidence that people keep saying that she was a marathon runner. No, I think she gave money towards a friend that was going to do a marathon. But from what I can glean from the many different strands of incredible newspaper articles, she was preparing for a 5K running, and she was quite active. 5K, if she were a marathon runner, as my daughter Francesca that you met earlier, who's a big athlete, said, she could have cardiomyopathy, and there could be other cardiac long-term effects from scarring when you run long distance that could lead one to sudden death. But if she's just a 5K runner, in her 40s, in the bloom of health, it is so very unlikely for somebody to have sudden death in the middle of the night. And so that, to me, I would classify that as a death that was not natural, and it would be incumbent upon me, let's say as a physician, to say, I know this patient, and I believe she needs a true autopsy, because she's doesn't have the risk factors for just sudden death in her sleep.
So what would cause the foam in the mouth that you were talking about? And now, if we're looking at an autopsy after the body's exhumed, how difficult is that going to be to do toxicology?
Yeah, that's going to be difficult. And it's also going to be difficult I'm assuming she was embalmed, and that makes it difficult to really get a fresh look at what was going on. Generally, with the foaming at the mouth, one can think of seizure. One could think of, then we get into some of the poisons or toxicology kind of things that cause frothing at the mouth, which the frothing comes from lung inflammation and what we call bronchorrhea. So like diarrhea is, loose stool and a lot of liquid. Bronchorrhea is the extra flow and extra production of fluid and salivation in the lung. And that could come from congestive heart failure. But somebody who's running and prepping for a 5K couldn't do it with congestive heart failure. And that would sort of bring us to, well, what would things acutely cause? And then that's where you might get into some of the toxins or the poisons.
Interesting. And what's circulating around the folks that you're aware of that you've come across?
In terms of what do you mean circulating around the folks?
The type of toxic elements that potentially could be in play here.
Well, I think, and I don't know if I sent this to you yet, but I'd be more than willing to. There was Ian Pulowski, who married Melanie after she quickly dumped Brandon Boudreau. I don't know if you follow all this.
Yep, we have.
Sorry, yeah. She kind of, the day after they got married in 2 weeks after having met one another, she sort of had what I call logorrhea, which is word diarrhea, to Ian, and suddenly, just literally, and there's 7 pages worth, and I have it, step by step, divulged the specifics of this cult. And as part of the specifics, and he documented all of this, it's East Idaho News has a copy. That's where I was able to obtain it. And that went to the police. And then Brandon Boudreau got involved because his kids, he felt, were at risk based on all of these sort of ritualistic, odd belief systems. And one thing that I gleaned from the statement of Ian Pulaski that then went to Brandon Boudreau and to the police, and it is for public consumption, is, I want to see if I can find the quote here, is the importance of malachite in their, I'm going to call it group. I don't want to call it a cult yet because I don't want to misnomer. But what he said was, do you mind if I read this? The court documents, the legal documents of Brandon Boudreau, obtained from the new husband of Melanie Pulaski, state that Chad and Lori's group use, quote, healing malachite solutions and balms. They believe that malachite has healing properties and it's used for blessings and rituals. And, then you have to segue into what is malachite and how is it used? And
exactly.
And, you could go down a rabbit hole on all of this. There are different kinds of malachite. The ones in their wedding ring, if they really are malachite and they're not plastic to look like malachite, those would be buffered or buffed gems that are not toxic. However, one can procure soft malachite green that is in its crystal soft form, and you can even get it on the internet. And there are really 4 ways that malachite can be given to people and can be lethal. And one is in elixirs, which they mention. And an elixir is to take the malachite and it's very water soluble. You put it in water, you add a little nicotine, and it makes it really sugary and yummy. And you put it in a cup of tea, and voila, you can be morto, as we say in Italian. So they did.
Amazing.
Sorry?
Amazing.
I think you're awesome. Keep going.
So that would be an elixir. Okay, so it's taking the crystal form and dumping it in some water. Could add some nicotine, which is also, interestingly, eating nicotine is extremely toxic. You mix the two, the malachite with the nicotine in water, it's yummy. And I hate to even say this because I don't want to give anybody any ideas out there.
Amen.
Nobody's looking.
Yeah. And then the other is just to make a regular tea and add the malachite and the nicotine. So, you could just do the elixir and say, honey, this is a malachite elixir that's going to bring healing powers to you, and yum, yum. The other is a balm. And so what you do is you take the dust of the malachite and you mix it with oil, right? And then you can spread it on people's skin. And in one of the gemology links that I saw, there were a husband and wife gemologists saying, do not ever mix crystalline malachite with oil to make a balm because it's absorbed into the skin and it can be lethal.
How long does it take?
Okay, so it depends on the dose. And the thing is that I wanted to bring, and I think I mentioned to Mike about a week or so ago, that because it's not something that you see so often, and there have been literally one scholarly study done on malachite poisoning from 1950 until the year 2008. One case study, which I read, and this had to do with a little 3-year-old, I think I mentioned study, who took I'm sure you're all familiar with an aquarium and you see that green sort of powder that's a fungicide that you put in the water to make sure the little fungus don't grow on the on the walls. And in the presence of her two older siblings, this little girl at age 3, and maybe this was mixed with something that was sugary tasting to her. You see, I don't know, but she did ingest approximately 2 ounces of the malachite fungicide, which is ubiquitously found in pet shops. And within 5 to 10 minutes, she became completely cyanotic, completely blue, stopped breathing, and she was ultimately saved, but she ended up in the intensive care unit. Okay. So, I mean, think about that. It took the little girl 5 to 10 minutes to become cyanotic, meaning blue, and hypoxic, meaning low oxygen. And
so this I think is a perfect time to kind of step, because they're almost one and the same kinds of questions that I have, into this fourth individual, which is Alex Cox dying and being found. So as we kind of continue the discussion, could you kind of think about some of the things you've read about how Cox is found, and we see the same kind of relationship thing happening too, a sudden, well, I don't know if it's sudden, it appears sudden marriage, a change of name. We just talked about that with Brandon and the fact that things kind of went fast there. There are so many similarities from these things. It's really intriguing.
There are similarities. Now, I will tell you that Alex, in finding that the 2 reasons, and he had an extensive autopsy, the 2 main findings were these acute, newly formed pulmonary emboli, which are clot. That's different from pulmonary edema. Pulmonary emboli, clots, and that was number 1. And that constrain, you can't breathe, that constrain your heart. And they did find a significant plaquing of his anterior descending cardiac artery, as like 75% blocked. So, I mean, in some ways he was a sitting time bomb, right? But so I understand that this ME could say, oh my goodness, he had blood clots in the lungs that tax your oxygenation, super tax your heart, and then you die of an infarction, and voila, right? But what I find curious, and this is what I've been just trying to figure out, is that generally, I mean, there are many risk factors for people to have a pulmonary embolus. Now, embolism means traveling, okay? So traveling, pulmonary means lung. So you have a pulmonary embolus, it means it has to have you have to have had a clot travel from somewhere. And most generally, it's in your deep, the deep venous system of your lower extremities. Occasionally, it's in the deep system of your upper extremities. And I've had quite a number of young women patients get huge clots in their pelvic arteries, their uterine veins postpartum, because of the pressure of the baby causes stasis. They deliver and they end up with these immense clots, and some of them flick off and they die, or it's awful, or they live and we treat them. So I mean, but the idea is, if you're calling something a pulmonary embolus, it has to have traveled from somewhere, right? So I looked at I went from head to toe. They actually opened up his peripheral deep system. Mm-hmm. There was no evidence of any clot there, because when you flick off clot, the whole clot doesn't go. You still leave some behind, right? Mm-hmm. There wasn't even evidence that he had scarring from chronic deep venous thromboses, which he was a long truck driver, so they people that have sedentary lifestyle can get these. But and then they looked at all of his venous system, and the ME commented there was no evidence of coagulation. So my question is, so where did these newly formed clots come from.
So let me make sure I'm understanding this, Doc. Usually those would originate in an extremity,
Mm-hmm.
and there would be artifacts to support the creation of those in the extremities.
Whether
and those weren't present.
residual clot, I'm sorry. Mhm.
And those weren't present.
From what I can believe, no, there was no residual or it's a lot of times you might have a clot that's this long, in your deep system, and then you begin to flick off small, and they end up here, and you die, or they end up going up to your brain and you die, or you have evidence of scarring, so that it shows, okay, you had a clot and it all traveled and flicked off on the way, but there's some inflammation, etc., at the point of origin in the extreme. They didn't see that. So I have a little theory.
I'm ready.
Yeah, we're all ears.
I know this is like overwhelming.
Go.
And again, I should tell you.
Well, would this be a red flag? Is this a red flag?
Absolutely. I'm like, where did these clots? I've been scratching my brain and doing all kinds of literature searches on fish studies and all these different things, what happens to fish. And the only thing I can think of is that Alex does have a family history of blood clots. I think his father had one, his mother had one, maybe another grandparent or something who had cancer. Cancer is an underlying cause of production of clots in your deep venous system. But the thought might be, and I don't know if he was ever tested, is that there is a subgroup of people that have a hypercoagulable syndrome, where they're missing an enzyme in their blood cascade, and it causes them to make clots, to be hypercoagulable. And so he's never had a DVT, and I've had patients where they'll be happy as can be, but they develop a clot in their vertebral artery, but they're healthy, normal lipids, normal everything. They flick it off and have a stroke, and they're in their 40s. It's like, what? But then we do some testing. We find out that indeed they have this familial antiphospholipid syndrome, okay, which makes you at risk to develop these clots. So this is complete, I don't want to say speculation, but maybe theorization. I'm wondering if something happened. Was he given something that irritated his lungs, that caused his lungs to have some bleeding, and he, because of his underlying hypercoagulable state, developed acutely and locally clots in his lungs? Follow me or no?
Yeah. Oh, yeah.
No.
Yeah, we're tracking him.
What could have happened? So that brought me back to malachite and organophosphates were the two, and carbon monoxide can cause clots. But I tried to go through, like, where would he have gotten carbon monoxide? Paint thinners the fumes can have carbon monoxide, but malachite, especially if you inhale the crystals, can cause extreme irritation of the lungs, and you get a flu-like symptom, coughing, spitting up of blood, foaming at the mouth of pink. And you could maybe, as a result of that cascade of bleeding in your lungs with his underlying hypercoagulable state, develop multiple pulmonary clots. But I mean, this is like I'm out on, like, get me the tinfoil cap. I don't.
Yeah. Well, So we've got, out of the 4 victims here, 3 of them, I mean, let's be honest here, right? 3 of those are very, suspicious in nature in the totality of the circumstances here. Would you agree with that?
Absolutely.
Okay. So without speculating, right? Because that's one of the things that, we want to make sure that we're staying on track, that, we're looking at this, objectively. Who attended this particular autopsy here? Do we have that particular report?
Oh, let's pull that up. Yeah.
Yeah, because that
Yeah.
was interesting. That was interesting.
This was an
So-
amazing find that you had, Chris. I think you need to point that out. Yeah.
Mm.
Well, so for
You're,
all,
I have to say something, Chris. You always seem to find the kernel of like a point thing that is just boom. You're the kernel, right?
being a private, I always see kernels. That's how my life has always worked. I'm teasing, but so in the totality of circumstance, I think we have additional evidence here of just how close folks are paying attention on the law enforcement side
Mhm.
to these individual points of interest and potential, evidentiary finds. And Doc, I think you've laid it out really interesting. That is poison a possibility? I would submit in an investigative aspect, the answer is yes, it could be. And here's the reason why we know. Look at who attended the autopsy of Alex here. The last individual there, we have Gilbert Police Department and we have the FBI agent Carrie Cooper. Okay?
Mhm.
Now, that kind of gets overlooked. Okay?
Mhm.
But behind the scene, Mike and I both know exactly what that means. And we'll get into that in other videos as we go forward here. But, for our viewers and our, PE family here, pay attention to that. This is why we're going back to Gilbert and why we haven't, left Chandler and the Arizona area, why we haven't left that area yet. This is one of the reasons why. So I just want to kind of, tee that up. And then, so we look at the totality now of the malachite, the symptoms of the poisoning that you brought, to our attention, Doc. What are some other possibilities in terms of maybe organic
Right. Like
situations?
like the organophosphates, which are ubiquitously found in fertilizers, insecticides, and they can result in lung clots. And the mechanism is really a little bit unclear but it is known that you can get lung clots. You begin with, by the way, also defecation, which is basically diarrhea, excess salivation, bronchorrhea, or excess production of fluids, pink foam at the mouth, flu-like symptoms. And the thing with organophosphates is they're so easily found near farms. And most of the studies have been honestly done out of India because it's such an unregulated industry of farming. And, I even read a study where people were eating from a street vendor chapati bread, and the flour was laced inadvertently with organophosphate, and the people were just dropping dead. And it's a quick death, but with respiratory distress, with flu-like symptoms, with frothing at the mouth. But it is also difficult to tag or get a tox level because it's got such a quick clearance. So organophosphates would be another possibility, with blood clots as a possible side effect, especially I'm thinking in somebody like Alex. Like, in other words, let's say Alex had blood clots, and then Tammy, we don't know yet, but she didn't. But remember, Alex had an likely underlying hypercoagulable problem where he quickly makes clots in the face of irritation and bleeding. You see?
Mm-hmm.
So,
Mike, what did you find? Remember, there was something else you teed up on some of the organic stuff. Fox.
Yeah. There were a lot that kind of jumped out at us, and yeah, if you could maybe speak to this idea of foxglove, oleander, maybe a few of those, Doc, that aren't being really thrown out, but should probably be considered.
Okay, so now foxglove was the original digitalis that when we first, let's say, I don't know, 70, 80 years ago, discovered digitalis, which we use for cardiac problems. It came from foxglove. See?
Oh, interesting.
So
Dead man's bells, right?
dead man's bell. Now,
Oh,
the thing with foxglove is digitalis, and a lot of people are on dig, and it can be very useful, but only to a certain point. And then you give too much, and then you become a dead man. So that is possible, and foxglove is found easily. But the thing I don't think about foxglove is because we check dig levels all the time. When a patient comes in and they're on digoxin, we get a dig level to make sure they're not toxic. So would they have checked a dig level? It doesn't look like they checked any. They did a tox study. I don't see that, like on Alex, that they checked a dig level. But that would be less likely in my mind because foxglove, being digitalis, can't fly under the radar for checking for levels.
There you go.
interesting.
You see what I'm saying?
Yeah.
Now, the oleander or oleander flower is easily found all over Arizona and that part of the West. I mean, it's all over the place. And people make teas from it. People lick it, put it in salads, and it's, people are told don't do that because you can die from it. Okay. Don't lick this flower. It is a cardiac glycoside. I don't want to get into all the chemistry of it, but its main effect is that it causes heart block. So you just get heart stop.
Wow. Interesting.
So
Is it instant?
Well, if you take too much of it, it's pretty instant. Yeah. So
Interesting.
I'm just trying to match up, like, especially going to what we know about the two stories of Tammy. It wasn't an instant thing. It seemed like it went over a day, maybe overnight. So, I mean, it's a possibility.
Yeah, that was going to be my next thought. Can it be dosed up?
Yes,
Inadvertently.
Yes, it can be.
And will that stay in the plasma life of that dosage? Will that last through, and will that half-life be enough to take you out?
I don't know if they could actually get a level on that. That's
Okay.
a little above my scope of practice.
Okay.
I can't answer that. I mean, I could look it up for you. I don't know if I sent you a little bullet point, but
Yeah.
I sort of went under what slow poisonings over time are versus quick poisonings. And organophosphates, like these fertilizers, foxglove, oleander, carbon monoxide, and cyanide are quick. So it's not something you're going to do over a period of weeks.
Okay.
Where would malachite fit?
Now, the malachite can happen pretty quickly
Okay.
because especially if you now the balm might take longer because you're absorbing it through the skin and then it has to metabolize, right? But from what I have read, making the elixir or the tea, you drink it, it could be a pretty quick thing. Think about the 3-year-old girl
Yeah.
who had
Yeah.
the malachite green from the aquarium, and within 30 minutes, she was as blue as my jacket. And thank God, she had to get transfused and all of this. And she survived. So
what are the slow poisonings that are most probable?
Well, there's always antifreeze, which from what I understand is odorless and rather tasteless. Thallium, but it's pretty hard to find thallium, and strychnine. Do you know anything about? I'm not too familiar with strychnine. Are you?
It's rat poisoning, basically, isn't it?
That's what it is. And the reason, okay, thank you. And the reason the rat poisoning doesn't make sense is because the way rat poisoning works is it causes a block in the coagulation cascade so that you essentially bleed out.
Yeah.
all your orifices,
Yeah.
right? So, I mean, he
Yeah.
wasn't bleeding out Alex. She didn't sound, Tammy, as if she were bleeding out. And Mr. Joseph Ryan didn't sound like he bled out. So that would, I would point, that would be very unlikely in my estimation.
How
So-
would that interact with clotting, and would it
Yeah, that's
minimize
exactly what I was going to ask, Mike.
how would that interact with clotting, and would it minimize the I guess the evidence of clotting?
Okay, so with the rat poisoning you're talking about?
Yes.
So what happens with the rat poisoning is it causes severe thirst. And so you want to drink water, because the mechanism is that severe thirst, and then the cascade for clotting is interrupted, so you just bleed. So like when you see mice or rats, you give them the poisoning, they will leave your house because they can't get enough water. So they all run out of your house to go to the field to try to find water to drink. They likely can't find that water, and then what you see is that they're just got blood on them. I don't think it was strychnine.
Yeah, that it's in the pesticide, industry. And in all of my years, I had a couple of cases where, they thought that those types of poisons in that family could have been utilized, but it turned out not to be. So one of the things I am curious to dovetail into Mike's point there a moment ago, how does this present? The malachite poisoning, how would this present itself? Because it's attacking the lungs, and the heart, if I'm hearing you correctly.
Right. So yes, I'm sorry. Excuse me.
No, that's fine, Doc. I mean, explain for our viewers, what would you see in the ER if you knew, right, that malachite could be in play here? What would be the presentation?
Right. So then you're looking at like flu-like symptoms, feeling weak, cough. And then as the lungs become more irritated, you're going to get more shortness of breath. Mm-hmm. You're going to get bleeding. So that with that bleeding and inflammation of the bronchioles, the air, the oxygen that you breathe in cannot get through to oxygenate your body. So you become less able to oxygenate. You become hypoxic, meaning low oxygen, and that puts a tremendous strain on your heart. Mm-hmm. So therefore, somebody like Alex, who had 75% plaquing of the descending artery, the anterior descending artery, he could easily succumb to heart attack if his poor little heart has to work harder and harder to get the oxygen that's not coming from the lungs too much, pumping it out, and he could overwhelm his heart.
Okay, so essentially, you have this poisoning type. If this was, this is a hypothesis right now, right, and a hypothetical. You have this poison, just beating at your heart, and at the same time, your oxygen levels are starting to go like this.
Right, because what happens is that the malachite, especially if it's inhaled and or even with the elixir, which is the tea, if it makes its deposit into the lungs, your lungs no longer can absorb oxygen. It's like putting plastic over your lungs. So you might be breathing in, but it's like you can't get it in. So
it's a suffocation.
It's a suffocation. Yes.
Wow, that's brutal.
Yeah, it is brutal. And so ultimately heart failure. There was something else that I was thinking about.
And one thing that maybe that I'd like to do is just recap a couple of things. One, when we look at Joseph Ryan, there's enough question that we hope something more is being done there, right? A second look.
But I think it may be. I read, but it's so hard to know in the media what truth is sometimes. But that the FBI may have reopened this to look into, especially given, as we talked earlier, common things are common. It's easy to do one autopsy in a vacuum, but then when you get a series of related people who are dropping dead, then you kind of have to take a step back and say, let's look at some patterns here. What's going on here? And so I think it is incumbent, if they haven't, I would say it is incumbent upon the law enforcement to look deeper into his death. And I would be interested digitally in knowing well, of course she had her phones, and I don't know about those throwaway little phones. You could answer that better than I. She had upwards to 6 or 8, this is Lori Vallow, of those burner phones.
Burner phones, yeah.
So are they traceable or not really?
Yeah. I mean, you can get you can get the carrier. That's not a problem for law enforcement. It's a company called Bandwidth. So anybody out there thinking of buying a burner phone and you think you're going to get away with it, reconsider that. Because
well, that's good to know, because I'd be curious to
I'm
know.
in that play.
Good. I would like to know her digital footprint back to his house. Did she enter his house in the days preceding his death, in the days post-mortem?
Yeah, all of that's going to come out, Doc, and we like you are on pins and needles waiting to hear some of the other additional information that's going to present itself. So I don't want to go too far down that hole yet. Just, because we want to have you back for other stuff. That's for sure.
Thank you.
So Joseph Ryan, we need to look at a little more. We would hope that someone's going to look at a little more. And there is some tissue that more research and study can be done. Yeah. And then we have a body with Charles Vallow that was very interesting. And I'll just ask you both. Do you think that there needs to be a little more discussion around that body and the positioning of that body?
I would say so. How about you, Chris?
I agree. 100%.
Yep. Really makes you wonder about the staging that may or may not have happened there. That was either a perfect fall or some staging that's gone on there. Tammy Daybell, thankfully, she's been exhumed, and hopefully, from the sound of things, Doc, the embalming process and the fact of time isn't impacting too much negatively the ability to get more evidence there.
Right. You hope, fingers crossed, that they'll be able to determine a little bit more about the surrounding, sort of triggers of that death. Yeah.
And then we go to Alex Cox, who dies, and we have gone through a list of things with both Tammy and Alex, and frankly, may even reach back to Ryan, that talk about these elixirs. But one thing that we continue to hear about in the public arena, and they can be attributed to a bunch of different people, are the fact that some of these potions are talked about in the theology of this group. That's frightening.
Yes, and I have those documents that I can send you that actually East Idaho News published, the police statements from Pulowski / Brandon Boudreau, which delineates the use of malachite potions as part of ritualistic behaviors.
Wow.
Interesting.
And I guess one assignment I'd love to give our listeners is we keep hearing over and over again about the life insurance policy from Joseph Ryan to either a split to Tylee and to Lori, or to her in totality, with the idea that she's going to take care of this child. It'd be wonderful if anybody could scrape that up and put it in the evidence room. Mm-hmm. That would be fun to be able to have. It would be really interesting to see if Chad had an insurance policy on Tammy, and
he did
that. And what do you know about that, Doc?
Okay, I didn't mean to interrupt you.
No, you're fine.
It's what we do.
We're good.
Okay.
Keep going. Keep going.
Chad increased a couple of weeks prior to her death Tammy's life insurance policy. Okay, and
that was timely, wasn't it? That was very, very, fortuitous.
Up to $430,000.
Wow.
Okay, so that was done, and there is a trail for that.
Now, he was no longer married to her. Is there a nexus to show him getting value, or did that just benefit the children?
No. Well, that's my question. From what I glean, he was a widow, right? At that point. So getting remarried even 2 weeks later, I believe he was able to reap the benefit of that.
Yeah.
That might be another question for the evidence room.
That would be great if somebody could scrape that one up and put it in the evidence room too. Yeah. And then we look at Charles. Oh, go ahead. You found something there, Doc?
No, I want to talk about Alex and Sulema.
Yeah. So, and then Charles Vallow, in a brilliant move on his part, he moved the benefactor or the beneficiary of his policy so that it went to his sister. Although there were some questions about whether there was maybe some finagling to try to get that redirected. But yeah, now let's talk about the one thing, again, folks, if you have anything on that, please put it in the evidence room. And then if you find the policy on Alex, we would love to see that policy put up. But what do you know about that one, Doc?
Okay, well, I don't know anything about that. However, I do know that the rapidity with which Alex, who had never been married, got married the day after he left Rexburg, when the police had come back looking for JJ a second time, and they were told the JJ was with Melanie Gibb. When the police came back a second time, all three, Laurie, Chad, and Alex, split. They went incognito quickly. Laurie and Chad maybe over to California and then on to Hawaii. Alex, the brother of Laurie, went over to Sulema, who is a very, very dear friend, apparently, of Melanie Gibb and of Laurie, and married her and took her name. And now she'd been married a batch of times too, hadn't she? That was her 6th marriage.
6, wow.
Right. And
she's a whole nother show.
She's another show, but I think that from what I have looked up, just doing sort of those life search things when, on the internet and whatnot, and I think Melanie Gibb actually in her letter to a vow, I don't know if you know about her 7-page letter to a vow.
Yes.
Gibb sort of trying to sort of redeem herself for her mistakes, alludes to a really good friend who used to be a healer and did things for money, which it is thought that woman may represent Sulema Pastenes, until she came, to her faith in the LDS religion. But she is down, and I can send you that blurb if you want, as 3 things. Sulema Pastenes, and of course she had other names, like I think one was Porter because she'd been married so many times. She is a healer. She is a certified love cuddler. I don't know if you know what that is.
Yeah.
And
get your embrace, Mike.
Yeah, get your embrace.
Call her up.
Mm-hmm. And then apparently operations services supervisor at the Colony Group in Arizona. And the Colony Group is a life insurance large company. And so I'm wondering, what role does her ability for life insurance? Did Alex have life insurance? Who got the life insurance? So that's another thing that maybe folks could look a little bit into.
That'd be great if anybody knows about Alex and whether he had a life insurance policy and can post that up too. And again, folks, public information. Please search the public information. Let's not break any rules to get this information, because we want to make sure that law enforcement still has access to the things that the rest of us don't. but that we're getting the things that have been made available so that we can theorize about them.
Now, she was also had multiple drug-related arrests with respect to, I believe, meth in the past.
Oh, there you go. So, Michael, where are we at with the totality of these circumstances right now in terms of we've got 4 dead individuals. We've got potentially, with Doc Salerno, being here today, telling us about all the possibilities of some of these organic or, maybe there's some poisoning going on board here. We don't know yet. But, in her professional opinion, I have felt like I have been, standing around in the ER and just, back in the day and just say to the doc, what do I have here? And I've got to tell you, it's been fun having you, because I just love this kind of stuff. And,
it's fascinating.
And thank you. I mean, I just, I don't know. I hope our viewers are just going to have a ton of stuff to do tonight. And because I think we could probably go on here in reality for another 3 hours.
Probably. I think that one thing I want to say is that one of my mantras is that, medicine is, I always tell even the medical students, the residents, and the physician extenders like nurse practitioners is that it is the practice of medicine. It is not a pure science. It's a healing art. And the practice of medicine means that every single day, each of us should, God willing, learn something new so that we can practice better and better medicine. And none of us is above reproach. And I think if you talk to 10 different physicians, you might get 10 different points of view. But I think a crucial thing is, and I feel very strongly about the importance of critical thinking. And I think I've mentioned to you this idea of a scaffolding, like let's start here and let's fill it in. But let's remember that this ultimately is the practice of medicine. And we need to be humble. I mean, I try to be humble every day of my life. And I say to the people I work with, if I haven't learned one new thing today, then I am not a good physician. So that's my disclaimer here, is that I'm not promising perfection. And as I tell my children, there is no such thing as perfection in life. There is only progression towards perfection. So we're all progressing.
Interesting.
That's amazing. Chris, anything you'd like to add?
I'm just grateful that we've had the opportunity to meet, Doc Salerno, and we know that you have given us an education tonight, very much so. And we hope that our viewers, don't forget to pound that subscribe button and push that thumb. And hopefully, we're going to have you back at some point. And this has been fantastic. And your daughters are lucky to have you. Your community's lucky to have you. The fact that you operate from your heart and you're affecting people that don't have the means to get that help, but you're there for them. I applaud you and commend you for that part of your life, and that humility does come through and show, and it's genuine. And I'm grateful to meet you for that.
Well, I'm so tickled because the first time I saw you, the very first not podcast, your very first time, right? And you were kind of sitting back. You were sort of lurking back a bit, and you were sort of going to do this. And I thought, this is really interesting. It's almost like frickin' frack.
I told Mike I'd lower his property value, and I still mean it to this day. Our friendship is something special.
Well, it has been. And Dr. Salerno, we can't thank you enough. You have such a busy schedule, and for you to carve out a little time to share with us some of your thoughts, including the time that you spent just to research so that you could have a little different kind of an idea and theory, makes me think always, and we've talked before about Sir Arthur Conan Doyle, who was Sherlock Holmes, if you remember, and he always kind of reminded everyone that it was a capital mistake to theorize before you have facts, because invariably you end up spending all of your time twisting facts to meet your theory rather than allowing the theory to come after the facts evolve. And I suspect you, like us, will welcome any new facts that roll forward in this case to help point. We're not pointing fingers at anyone, but we're sure saying there are a lot of interesting facts that need discovery and answers to, and how exciting it is for everyone to be able to communicate in that way. And folks, if you're out there and you've got some ideas about this, or you found some golden nugget out there, go to profilingevil.com/evidence room and enter it in, and we'll put it in front of people like a Dr. Salerno or some of the other amazing people that we get the opportunity to work with. And until we have a chance to talk again, Dr. Salerno, thank you.
Yeah, thank you.
It was an honor and a privilege, I have to say. I'm thrilled to, participate and collaborate.
Oh, it's so fun to be with you. And
Yes.
to my friend Chris, who has taught me so much over the years, thanks a lot. Folks, until we get the chance to see you again, we just wish you the very, very best, and thank you for joining us today.